Hi everyone. In this video today let us discuss one of the new generation antidepressant, Levomilnacipran. So what is this drug Levomilnacipran? This is one of the drugs classified as SNRI, Serotonin Norepinephrine reuptake inhibitor. So this drug is going to inhibit the reuptake of two important neurotransmitters. One is norepinephrine and second one is serotonin. Actually, this drug is introduced as milnacipran, and here levomilnacipran is one of the levoisomer of this drug, which is available under the brand name Fetzima. And this drug particularly acts on the CNS, where it is going to increase the levels of norepinephrine as well as 5-HT by inhibiting their reuptake, which improves the symptoms of major depressive disorder. That's why levomilnacipran is indicated for the treatment of major depressive disorder. And its efficacy and safety in the treatment of fibromyalgia is not still established. Even milnacipran is indicated for fibromyalgia. Levomilnacipran is only indicated for the treatment of major depressive disorder. So today in this video we are going to see how this drug acts, what is its chemical nature, what are the important precautions, side effects, doses, all these things we will discuss in this video. First of all, what is the chemical nature of this drug? So this is the structure of levomilnacipran. Within the structure, we can observe the carboxamide moiety, which is attached to cyclopropane ring. So let us give the numbering to the cyclopropane. This is the first carbon, second one and third one. So at the first position, carboxamide is attached. So we can write the name as cyclopropane 1 carboxamide. So simply levomilnacipran is the derivative of cyclopropane 1 carboxamide. And on the nitrogen, it is having the ethyl side chains. So we can write this as NN diethyl. Then again at the first position, phenyl ring is attached. So 1 phenyl. And second position, amino ethyl side chain is attached. So 2-amino ethyl. That is the complete name of levomilnacipran. Now let us see how this drug acts. Within the CNS, one of the important neurotransmitter is the norepinephrine. So these are the presynaptic neurons, and postsynaptic neurons are equipped with norepinephrine receptors such as alpha and beta receptors. But the release of norepinephrine is controlled by calcium-mediated exocytosis. When the action potential reaches to the presynaptic neurons, they can be depolarized such that the calcium can enter to produce the exocytosis. Due to this depolarization, now norepinephrine can be released and it can act on norepinephrine receptors located on postsynaptic neurons. This produces activation of postsynaptic noradrenergic neurons. But the action of released norepinephrine is controlled by its reuptake into the nerve terminal. So on the presynaptic nerve terminals, one of the transporter is present, that is norepinephrine transporter. This is responsible for reuptake of norepinephrine, resulting in the decreased availability of norepinephrine at the synaptic cleft. Similarly, another neurotransmitter is the serotonin. So this is the presynaptic neurons, and these are the postsynaptic neurons which are equipped with 5-HT2 receptors. Just like the norepinephrine, when the action potential reaches to the presynaptic neurons, 5-HT can be released and it can act on postsynaptic 5-HT2 receptors. This results in the postsynaptic activation, but again, the action of released 5-HT is controlled by its reuptake. So one of the transporters is a serotonin transporter, which can increase the uptake of 5-HT so that the availability of 5-HT within the synaptic cleft is going to be reduced. Now in the depressive patients, the transmission of norepinephrine as well as 5-HT are somewhat reduced. In such conditions, levomilnacipran can be given, which can block the norepinephrine transporter so that norepinephrine is not taken into the nerve terminal. Similarly, this drug can also block the serotonin transporters so that the reuptake of 5-HT is somewhat reduced. In this way, levomilnacipran can increase the levels of norepinephrine as well as 5-HT within the CNS, which increase the neurotransmission, thereby it improves the symptoms of major depressive disorder. What are the precautions? One of the important precautions of levomilnacipran, just like other antidepressants, this drug can also precipitate serotonin syndrome. Since this drug is going to increase the 5-HT levels within the CNS, It can produce few of the symptoms such as anxiety, agitation, increased heart rate resulting in the tachycardia, hallucinations, and even it can produce some tremor. All these symptoms can be observed with levomilnacipran, which indicates collectively as serotonin syndrome. So any of these symptoms are closely monitored, and other drugs which precipitate the serotonin syndrome such as SSRIs, other SNRIs, MAO inhibitors, they should be carefully combined with levomilnacipran. Similarly, this drug can directly increase the heart rate resulting in the tachycardia. This increase in the heart rate may affect the blood vessels resulting in the vasoconstriction and increase in the blood pressure. So during the use of levomilnacipran, both heart rate as well as blood pressure should be closely monitored, as this drug can increase the risk of hypertension and tachycardia. Similarly, this drug can increase the risk of bleeding. This is more important when this drug is combined with other drugs such as NSAIDs, such as aspirin, otherwise anticoagulants like warfarin. These drugs can increase the risk of bleeding when they are combined with levomilnacipran. Alone, this drug may not increase the risk of bleeding, but when it is combined with NSAIDs and anticoagulants, the risk of bleeding is more increased, and sometimes it can also increase the nasal bleeding resulting in the epistaxis. Levomilnacipran can also increase the risk of angle closure glaucoma. So in the patients with any narrow angles, this drug can increase the intraocular pressure. So in such patients, this drug should be carefully given. As levomilnacipran is indicated for the treatment of major depressive disorder, so this drug can increase the mania or hypomania. So mood swings can be observed with this drug. And this drug can also increase the urinary retention, and it can also increase the risk of seizures. So all these things should be carefully monitored with the use of levomilnacipran. Similarly, this drug can increase the hyponatremia, the decreased sodium levels within the serum. This is particularly observed with inhibition of antidiuretic hormone activity. And this drug can also produce loss of libido, resulting in sexual dysfunction. What are the side effects? The important side effects mainly include constipation, tachycardia, palpitations. It can also induce nausea and vomiting. Hypertension, increase in the blood pressure, and as well as heart rate can be observed. Excessive sweating can be observed with this drug. This drug can also precipitate the testicular pain, erectile dysfunction, and ejaculatory problems. Other side effects mainly include flushing and loss of appetite can be observed with this levomilnacipran. How it is given? This drug is available as extended release capsules at different strengths such as 20 mg, 40 mg, 80 mg, as well as 120 mg. The initial dose is started at a low dose such as 20 mg given once daily. And based on the efficacy, the dose can be slowly increased after at least 2 days of treatment, so that the dose can be increased up to 40 mg given as once daily. And further increments can be done after 2 days of treatment, such that the dose is going to be maintained in between 40 to 120 mg, again given as once daily. In this way, levomilnacipran should be started at low dose and it is maintained in between 40 to 120 mg. So that's about this drug levomilnacipran, which is a SNRI, Serotonin Norepinephrine reuptake inhibitor. Just like other SNRIs, this drug can also precipitate the serotonin syndrome and increase the risk of bleeding with other NSAIDs and anticoagulants. And it can also increase the heart rate resulting in the hypertension. So these things should be closely monitored when this drug is prescribed for longer periods. And this drug is available as extended release capsules started at low dose of 20 mg and it is maintained at a dose of 40 to 120 mg based on the efficacy of the treatment. So that's the info about levomilnacipran. So that's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.